Good morning, everyone. We'll get started. Thank you for joining us and welcome to BCIRPU's 2021 webinar series. Today, our speaker is Dr. Mariana Brussoni. Mariana is BCIRPU's academic scientist, an associate professor in the Department of Pediatrics and the School of Population and Public Health at the University of British Columbia, and an investigator within the BC Children's Hospital Research Institute. Mariana is a board member of the Child and Nature Alliance of Canada and on the leadership team of Outdoor Play Canada. Mariana's research includes parenting attitudes towards risk and safety, developmental importance of children's risky play, design of children's communities and play spaces, and policy to support children's outdoor play. She has published her award-winning research extensively and has been widely featured in international media. Today, Mariana will be presenting on outdoor play. Specifically, why is outdoor risky play more important now than ever? During the presentation, if you have any questions or comments, please use the chat box at the bottom of your screen and I will ask them on your behalf. After the presentation, you may unmute your audio line to ask questions, or you can continue to use the chat box and I will ask them on your behalf as well. We are now ready for the presentation. Mariana, over to you when you're ready.
Thanks so much, Anita. It's a real pleasure to be here talking with you today. As Anita said, please feel very comfortable asking questions. It's really helpful to get a sense of where people's thoughts are at and any thoughts that they have come up. So I will also try and monitor the chat to see if I can weave in your thoughts as we go along. But yeah, we'll just launch right in at this point. So as Anita said, I wanted to talk to you today about why outdoor play and outdoor risky play in particular is important, but more specifically, why it's important now more than it ever has been. And so in general, what we'll be talking about is the what, the why, and the how. Why is it important? What gets in our way? And how do we support it? And of course, with thoughts to what we're all going through right now with respect to COVID-19. So before we get much farther, what I wanted to do was have each of you think about your favorite childhood play memory. Yourself back there and think about where you were and who you were with and what you were now, and even take a couple more opportunities here for everybody to vote. Okay, so I'm just going to show you the result. All right. So what we see here is the vast majority of you are outdoors, and that most of you were also taking risks. And when we do our research and we ask adults as well as children about their favorite childhood play memory, this very much reflects what you're showing here. So let me just go back to sharing my screen here. There we go. So hopefully, let me know if anybody, if you can't see my screen, but I'm assuming that everybody can. Thanks. Okay. So why is and that's such a compelling place to be, and our has and how to do it. So these features of outdoor play are actually, we're going to talk about that a bit more in a moment. I'll talk to you a bit deeper about risky play. So almost all of you have these memories, this, that risk was involved in your outdoor play memory. And so when we talk about what is risky play, it's really a term that has only come to be used in the last, 10 or so years. Before that, there wasn't a term for it because there didn't really need to be a term for it. It really was just part of natural part of kids' play. But as things went along, we've had these experiences where children's abilities to take risks, their opportunities to take risks, have been more and more and more limited as we as adults have become concerned about their safety and whether they could get seriously hurt. So what do I mean when I talk about risky play? Forms of play that involve uncertainty and the chance of physical injury. And each element of this definition is actually quite important. So you've got the thrilling and exciting part, right? So it's kids really push, just really going to that edge of comfort. And there's uncertainty. They're engaging in experiments with their own body, with the environment, with things that are going on, part of the fun, and it's a key part of them learning and feeling the thrill and excitement in these experiences. And the chance of physical injury. They're moving into physical injury. And so I'm going to talk a little bit later on about what the injury statistics actually show around, how they're actually quotes that came from kids, from Ellen Sensetter's work with kids, where they talk about what it feels, that all of you can relate to this and this kind of scary, funny feeling that they describe. And it's really important to keep in mind that risky play looks different for different kids, and so it's really not up to us to decide whether a child is engaging in risky play. It has their limits are. And so there's been several different kinds of risky play outlined in the literature. So the first kind is a hill really fast, say sliding or on a bike or something like that. Play at heights, such as climbing trees or other tall structures. Play with dangerous tools or other structures, very dangerous elements. So these could be things like fire or water or cliffs. Rough and tumble play, so play fighting. Play where there's a chance of getting lost. So this is, for example, kids being able to explore their neighborhood independently, or for much younger kids, it could be, say, hide holes in a play space where they feel like they are off and independent, not under the gaze of an adult. Play with impact. So it could be, for example, in some kids in childcare, you see them kind of taking a tricycle and ramming it into a wall. That's an example of playing with impact, or hitting a stick and feeling the vibration up their arm. Play. And this is particularly the kids, and kind of getting a vicarious thrill, and it can be a precursor to them engaging in their own examples of risky play. But an It's not an excuse for neglect.
Mariana.
Or recklessness, unnecessarily promoting risk. And I think it's really important to note, or yes, going on and off.
Sorry.
Okay.
Sorry, Mariana, I'm going to have to interrupt.
Sorry about that.
I think my internet connection is really unstable. So what I'm going to do is I'm just going to stop recording on my end, and I'm going to ask Marissa to record on her end. But you can continue your presentation as is, but I'm going to start recording on my end. Thank you.
Okay.
You can continue. Sorry about that.
Okay. Sounds good. Okay. No problem. The fun of Zoom. Speaking of COVID-19. Okay, so one of the ways that we can think of the risk that a child might not be able to manage or identify on their own. For example, broken equipment.
Sorry about that.
No problem. The fun of Zoom. Speaking of COVID-19. Okay, so one of the ways that we can think about risky plays is sometimes it's helpful to think about the difference between a hazard as opposed to a risk. And this is a bit of a simplification, but it helps kind of to frame the topic. So a hazard being something that a child might not be able to manage or identify on their own. For example, broken equipment, say glass shattered in a space, or other kinds of things where an adult would be helpful in identifying the hazard and trying to remove that. Whereas a risk is something where the child should be able to make a decision for themselves whether they want to engage in that. So like balancing on a log, going up this steep slide, that sort of thing. And so in injury prevention, what we're moving towards is not an approach that keeps kids as safe as necessary, as safe as possible, but looks at keeping kids as safe as necessary. So really looking at just how do we minimize the likelihood of the serious injuries and take away those kinds of hazards rather than taking risk out altogether. So in terms of the benefits of outdoor and risky play, if you think about your favorite childhood play memory, it probably makes a lot of intuitive sense, in terms of the kinds of benefits that it provides for kids. So for example, meeting up with your friends and figuring out what you're going to do and resolving your own disputes, that's really important for socio-emotional development. Cognitive development is supported by things like, coming up with plans and figuring out how you're going to engage in those plans, getting to know your environment and how to navigate that environment, things like that. There's also lots of opportunities for learning about numeracy and literacy in the outdoors and play. Physical development, you're moving your body in ways that you can't in other circumstances, and you're experimenting with that, and you're developing your kind of gross and fine motor skills and your physical literacy skills. Physical activity. So one of the strongest findings in the literature is really the link between kids playing outdoors and being more physically active. And in fact, there's even research to suggest that they're more physically active outdoors in play than they are even in organized sports. Mental health benefits, being able to figure things out for yourself and your own kind of the self-confidence and the resilience that comes from being able to, oh, wow, I did it, and I'm capable of it. And even if something goes wrong, that I can manage that, right? As well as research showing that this ability to engage in risks and this kind of gradual exposure to risks is also important for reducing phobias and fears around, say, fear of heights or fear of water, those sorts of things. So it's not really an exaggeration to say that play is the engine of optimal child development. And this kind of outdoor play with its risks has been seen as so important that there's been a lot of important kind of movements in Canada to help support it, because we've seen it go down in succeeding generations. So one of the important things that has happened is the release of the position statement on active outdoor play back in 2015. It was released as part of the participation report cards on children's physical activity, children and youth physical activity and movement behaviors in Canada. And so this is what the position statement says, and then it has a series of kind of myth busting and recommendations around these particular thoughts around the importance of children's access to active play in nature in the outdoors. And it was developed with a consortium of organizations, including me and the BC Injury Research and Prevention Unit, and represented a very broad group of stakeholders from all sorts of backgrounds. If you're interested in seeing it, it's on the Outdoor Play Canada website, and you can download it at any point in time. Now, in 2018, the Council of Chief Medical Officers of Health felt that this was so important that they actually released their own position statement supporting ours. And you can see the URL here. But essentially, this is the council of people like Dr. Bonnie Henry and her counterparts across the country that really wanted to figure out a way to support this kind of activity in children's lives. Now, why are they so concerned? Why do they want to see this reported? Well, there's a few reasons for that. As I mentioned, we've seen succeeding change over generations in terms of a movement from outdoor play and being physically active to indoors, sedentary, screen-based behavior. And that has had its own repercussions for children's health and development. And this is something that's an issue across the world. So for example, a couple of years ago, the report card, an international report card was released. There's a new one due out, I think this year. But Canada is not doing so well. So we get a D+ in physical activity, an F in play, and a D- in active transportation. So it's clear that there are issues, serious issues with children in Canada. A further reason why this is seen as important is actually because kids getting access to healthy microbiomes and getting their hands in the dirt. So research out of UBC and elsewhere showing how important it is for children's gut health, which then affects all sorts of aspects of their well-being. Even their myopia, short-sightedness, and the fact that it's that this is increasing drastically as children are moving indoors and on screens. And so recommendations from ophthalmologists that children be outside 3 or more hours a day to help reduce the likelihood of myopia. And then we know that there's serious mental health challenges in Canada with 1.2 million Canadian children, and this is before the COVID pandemic. So we're really dealing with a serious problem here, and we need to think about how to support kids in their mental health. And we have 26% of children entering kindergarten developmentally vulnerable in one or more area. And so again, you know, we have an opportunity to really support these kids and think about equity in supporting these kids. And so there's lots of scope and opportunity to think about how outdoor play can help and how we can help promote outdoor play to help with increasing the equity around these issues. Now, what about COVID-19? Why is it so pressing now more than ever? Well, there's several reasons for that. So we conducted a study, and this was a survey of parents in April of last year. So it was right during the heart of the very first lockdown across the country. And some kind of concerning results came out of that. First of all, we were saying that there's more sleep, so that was positive, but there's also way more screen time and sedentary behavior, and less physical activity and outdoor play, a lot less. And in fact, only 2.6% of children and youth in this country were meeting 24-hour movement guidelines. And that's really concerning. And in fact, we've just done another poll and finding that there is no change. This is still a big issue. So we've seen what was already a concerning situation has become even more so. But further than that, the reason it's so important to get kids out to play is that playing outdoors actually is positive for immunity, boosting immunity. So physical activity is helpful for immunity, exposure to vitamin D, but also the mental health that comes from being outdoors, being physically active, playing. Play is a really important part of how kids make sense of the world and process stressful experiences. So you can imagine that this unprecedented time is a really important time for them to do that. And furthermore, we know that transmission is less likely outdoors, not just for COVID-19, but for all sorts of communicable diseases. In fact, this is the BC Centre for Disease Control hierarchy of infection prevention and exposure control measures for communicable diseases. And this is something that they've been releasing quite regularly as a result of the COVID-19 pandemic. And I just want to highlight for you that being outdoors, so as you get to the kind of bottom of this triangle, they're the least effective methods, and at the top are the most effective. And being outdoors is way more effective than even personal protective equipment or physical distancing or most of the other things that we can do to prevent COVID-19 and other infections. So how can we make a change? Well, how can we provide supportive outdoor play environments? So there's three key ingredients to supportive outdoor play environments: time, space, and freedom. So having the time, actually carving out the time and making sure that that's a priority for kids to get out every day to be able to do this kind of work. Space, having the kind of space that kids can easily access. And part of that is city planning to make sure that any child can access readily available outdoor space that's high quality wherever they go. It also means things like childcare centers and schools prioritizing this and providing things like, say, loose parts that kids can play with, like, sticks, mud, sand, rocks, all those kinds of things in order to support really high quality and diverse play experiences where the kids can really stamp their own imagination onto the play. The third ingredient is freedom. And the biggest problem with freedom is us as adults and our fears around kids engaging in risk, maybe getting hurt, the uncertainties, not knowing whether how things will turn out. And I call this anxiety-based caregiving. And I see that we're in a bit of an epidemic now around anxiety-based caregiving, where our fears about our children's, safety and all sorts of other fears are really driving the decisions we make around what they're allowed to do, rather than kind of trying to see past those fears to what children might actually need for their own health, well-being, day-to-day joy, and satisfaction and happiness. I think this quote summarizes it quite well. In fear that death can take away our child, we take the child away from life. So what I wanted to get into now is actually just a bit around the injury statistics to see, are these fears actually borne out by what we see in the injury statistics? So this is a graph of injury death rates for kids 0 to 19 years, and we're looking from 1950 to 2009. And so you might notice that there's been a very large increase between 1950 and 2009. And so, in fact, what this graph is showing is that it's never been a safer time to be a child in Canada than it is right now. And that's fantastic because it means that efforts from many of us, from the BC Injury Research and Prevention Unit, many public health people across the country have been incredibly successful in making it safer for kids. So one might look at this graph and think, okay, well that's great. It means that our approach to reducing children's risk and risk-taking in play is working. So you could interpret it that way. But I want to point out a few key things around this graph and what's going on. So you might notice that in the 70s, there's this big drop around 1973. You've got kind of a little bit of a drop and then a big drop in 1973. And I'm just, you might reflect what happened, in 1973. And so what happened in 1973 is that we had laws passed around seatbelts. So first of all, a law that seatbelts were required in cars. And then from, I believe it was 1976 on, Ontario was the first province to pass mandatory seatbelt use laws. And that went across the country until 1990, which the last province, Alberta, passed their laws. So you can see that a lot of this gain is connected to seatbelt laws. Also, there were increased penalties for driving under the influence and some key kind of product safety changes that happened over that time. But what I can tell you is that children's play wasn't killing kids back in the 70s, and it's not killing kids now. So our fears and anxieties around what could happen to kids around play are not founded in the statistics. And just to show you a bit more around that, so I looked at the Statistics Canada data for deaths for kids 1 to 14, as much data as I could pull. So I looked at data for falls from play equipment and then falls from trees, and across the years that you see here. And so just to give you a sense of the numbers that we're looking at, there's about 7 million kids in Canada aged 1 to 14. So when you're dealing with 10 years of data, like you are for falls from play equipment, you're dealing with 70 million children. And when you're dealing with 17 years of data, it's, I think it's, let me see, not 130 million. I'm not doing the math on the top of my head. It's a heck of a lot of kids. And when you're looking at kind of numbers of deaths from cars, we would be looking in the hundreds and even thousands in the same time frame. And yet, when we look at the statistics for deaths for these two, here's what we see. There's been 2 deaths from falls from play equipment across 10 years of data across Canada. And there's been 0 falls from trees, not one. And so I think it bears us really thinking carefully about whether our anxieties are justified. Okay, well, what about medically treated injuries? Well, there was a systematic review done that looked at the research that had actually looked at the exposure time, so the amount of time that kids spent doing an activity, with whether they had a medically treated injury. And so they looked at 3 different kinds of activities. Active commuting, so this would be like things like walking or cycling to school or elsewhere, sports participation, and then play. They wanted to see, what are the injuries related to that? And what they noted was that also the medically treated injuries was defined very differently in different papers. So in some papers, it involved, say, going to the nurse's office at school to get an ice pack. In others, it would involve actually going to the emergency department to be treated by a physician. So what they found. So first of all, that play had the highest number of injuries. But when it came to exposure, it had by far the lowest. So it had 0.15 to 0.17 medically treated injuries per 1,000 hours of exposure. And that in fact, sports participation had a much higher rate of medically treated injuries than play. So what does 0.15 to 0.17 per 1,000 hours mean? It's a bit of a nebulous term. Well, essentially a child would need to play 3 hours a day, every day, for about 10 years to clock the number of hours required to have one medically treated injury. And even then, it's likely to be minor. So even when it comes to more minor injuries, we're not seeing the data supporting the need for this worry and this anxiety and this control that we've put on children's play. I also think it's really important to consider that children being able to engage in risk and risky play and moderating that for themselves is critical to the development of risk management skills. This is not something that you can learn by being told or in a textbook. You need to experience it. You need to have that kind of knowledge of how your body moves and how the world reacts to your body moving. So keeping kids safe actually means letting them take risks. So hopefully I've given you kind of a big picture perspective and understanding of why this is so important and that we need to change our perspective around kids engaging in risk and outdoor play and making this a priority now in particular more than it ever needed to be in the past. So I'd like you to think about maybe what one thing can you do differently to support children's outdoor risky play, right? One thing that you could do today or tomorrow, maybe you have your own kids, grandkids, nieces, nephews. Maybe you can think about some policy change or something else that you can do, something related to your work. One thing that you could do differently to support children's outdoor risky play. Sometimes for parents, I tell them about the 17-second rule. So the 17-second rule is that, next time your child is doing something that you just want to say, be careful, that you actually count to 17. That it gives you time to process that a bit more so that you can be like, is this actually a problem? And you can let the situation play itself out and your child be able to have the time to figure things out for themselves and to show you that they can figure things out for themselves. And while I'm talking about be careful, I just want us to actually think a little bit about what be careful, how damaging that can be for kids. So to hear be careful, what we as adults are saying are, I love you, I care about you, I'm worried about you and your safety. They are important to me. But what kids hear is, you don't trust me. You don't think that I can keep myself safe. You think that you need to do this for me. And furthermore, something like be careful doesn't actually tell them what they should be careful about. And so it's just kind of a useless safety prompt that actually could cause more harm than good, because they'll be like, be careful. Okay, what did I miss? Why didn't I notice? And it could distract them from actually, doing their risk management. So I just wanted to point you to some resources that you can access to kind of learn more and to help think about, some changes that you could make. We developed this tool, outsideplay.ca, which you can access online for free. We have a version for parents, and we have a newer version for educators. And we've actually, we did a randomized control trial for the parent version. We're in the process of doing a randomized control trial for the educator version. But essentially, we're using health behavior change techniques, the same kind of theory and methods you would use for, say, stopping smoking or improving exercise or the other kinds of health behaviors. And we're using those techniques to help adults think about this and take themselves through a series of self-reflective questions and consider other ways of doing things around supporting outdoor play. So that have a look at that, and there's also some information and infographics available there, if you want to distribute it to other people on the resources page. A great resource is the Outdoor Play Canada website. It's a platform that we've created to help unite people from very different areas and interests into this field so that they can find resources, new research, any sort of thing that can help them in kind of supporting outdoor play in Canada. Particularly relevant to injury prevention, we've developed the risk-benefit assessment for outdoor play Canadian Toolkit. And that is available on the Outdoor Play Canada website. And what it is really, it's designed for practitioners, for educators who are, taking kids out or have some time when they're out with kids in play and helping them think about some of the risk management and balancing the risks and benefits and how you do that. So this is a toolkit that takes them through kind of different scenarios and has different things that they can fill out to think about these and go deeper on it. So I want to stop there because I want to give lots of time for discussion and questions and basically have you unmute yourself. Here's my contact information. Though don't bother calling me because I'm not allowed into my office. But you can contact all sorts of other ways that you see here. And I'm just going to stop sharing my screen so we can have a chat. So any questions?
Thanks, Mariana. So if you have any questions or comments regarding the presentation or for Mariana, please feel free to use a chat box or you can unmute your audio line.
I see that there's some practitioners on here that are extremely experienced. So I'm honored that they're on, like Megan Zaney. Nice to see you on here. Rachel. Okay, here's a question. I really needed to hear this. My boys climb trees and I start to feel physically ill when they pass 20 feet. So far, my way to handle this is to not look. I don't think it helps to put a height limit to this. Thoughts? Yeah, great question, Jennifer. And I'm also often asked, is there, say, a height for specific ages or even like when can my child walk to school? What age is appropriate? Those kinds of limits or, just kind of blanket statements around when kids are capable, I find extremely unhelpful. First of all, because kids are so individual, some of them are more experienced than others, and they really need to be able to set for themselves those guidelines and really feel comfortable in and of themselves and figuring out how far can they push themselves, and that's going to change too. So your kids, one day might be at 20 feet, but the next day they feel, I'd like to go a little bit higher, right? And so these kind of artificial height limits are really unfair and limiting and imposing. What you can do and what we recommend in the risk benefit assessment is working with the kids. If you have concerns, sharing with them. It's okay to share with them, I'm feeling a little bit kind of scared, and here's what's going through my head, and so what do you think, how can we think about what you're doing in order to try and manage some of the things that I might be afraid of, so like a branch that is not capable of taking your weight or things like that. So really having a conversation and involving the kids in that risk management. So hopefully that's helpful, Jennifer. Let me know if you have other questions. Amika, could you give us an example of what kind of risky play could practice in 6 months to 2 years? Yeah, so there were, it turns out that even kids that young are engaging in risky play. And if you think about even like them learning to walk, that's an extremely risky activity, right? And they could fall, they could hit their head, they could get injured, but it's such like, how else do you learn to walk than from actually doing it? So the two new categories of risky play, so the play with impact and the vicarious risky play came out in particular for those really young kids. And so the vicarious risky play, I think in particular, is one of those that's seen more in the young kids in terms of kind of watching other people and getting, all excited about what's going on, and then maybe trying it themselves. So, but yeah, excellent to point out that kids of all ages really need this kind of play. Donna, how does the increased use and promotion of safety equipment and helmets reduce the incidence of injury? So it's a great question. And what I would suggest you have a look at is the Active and Safe website. So it's Active and Safe. Anita, if you could look it up for me, I think it's activeandsafe.ca, like the whole word, but it might be activesafe.ca. Maybe if you could post it in the chat. That actually has some great stats because it breaks it down on the different types of recreation and sports activities and how safety equipment is helpful, and which safety equipment and so on. So have a look at that for some great information. Caitlin Atkinson, no questions, but I agree with this completely. I'm planning out our summer camp programs for the city of Williams Lake, and I think it's something I'd like to add this year in our leader training, how to approach risk and how to appropriately mention specific risks that exist in the environment to our campers. Fantastic, Caitlin. And man, I love Williams Lake. It's such a beautiful area. So have a look at our risk benefit assessment framework, and hopefully that's helpful for you in your planning. Kara, thanks for sharing that. Yeah, the Saskatchewan Prevention Institute has some great resources on risk and play. And thank you, Anita, for the Active and Safe link in the chat. Thomas, great presentation. Do we ever grow out of need for physical risk and outdoor play? Is there any research on outdoor play on the adult experience? A fantastic question. I think we need to take risks and risky play throughout our lives. What that looks like changes. If I think about kind of my own journey, I used to do a lot of downhill skiing, and that's something that I've become a little less comfortable with actually as I get older, and I've moved more towards Nordic skiing as what I like to do and what feels kind of more in tune with where my body's at. But that's getting outdoors and playing and what occupational therapists call the dignity of risk is important for all ages. And I'm thinking like, in discussions with Kara and some of the others is thinking about fall prevention in older adults, particularly those in long-term care facilities, and the dignity of risk in those contexts, and how, we've seen examples of older adults activities being severely limited because there's such a fear of fall prevention, and yet there comes a point at which the quality of life just really reduces, and you're not really giving them independence as well as the ability to kind of manage their own risks. So I think it's all ages this applies to. How can you convince school teachers of the importance of risky play? Most answers I get sound like easy to say for you, but we are responsible. Oh, well, Megan Zaney is the expert at convincing school teachers. So first of all, Dieter, please go to our outsideplay.ca, the educator tool. does have some useful stuff there in terms of kind of the kinds of arguments you can use. It is focused on early childhood, but there are some really helpful things there for all ages. So have a look at that. But I'd also encourage you to have a look at Megan Zenny's website. Megan, would you mind posting it in the chat for me? Because she has such lovely blogs and tools, and actually provides professional development. So if Megan doesn't manage to do it, I'll look it up myself and post it in a few minutes. And Megan, if you have any other thoughts, please also share them.
Okay, I'm listening. I'm going to put my thing in right now. Sorry.
All right. Do you have other thoughts, Megan, that you can share?
From what you've been saying, I think it's different. In my experience, it's different between when it's your own children and when it's other people's children. And I think that there's a different response to some of these questions, depending on whether they're your own offspring or whether you are the responsible adult. Your duty of care feels elevated when you're working with other people's children. So I would just say that sometimes thinking through working with colleagues and making sure that everybody's sort of on the same page around that, or making sure that you're really transparent with the other adults, meaning the parents or the people you're working with, what the importance of this is for you. That's what I would add.
Yeah, thanks, Megan. And actually, that brings to mind the OPAL program, Outdoor Play and Learning, which started in the UK, but actually is now even in the Toronto District School Board in Canada. And they really talk about the importance of, so for example, first of all, like creating a play charter for the school that outlines, yes, we need OPAL across Canada, thank you, Lynn, that outlines, what is the philosophy of this school and the whole school board around play and the importance of outdoor play and risk taking and how we approach it. Then making sure that it's a core part of training for everybody, and that there's a champion at the school that keeps everybody engaged in that, and that there is constant kind of measurement of how progress is going. But essentially what it looks like kind of on the play space is they bring in loose parts and the kids can play during recess, and they think carefully about recess and how much and how it's structured and all of that kind of stuff, and the training that the people supervising recess get, as well as the teachers, to be able to use this resource in their teaching. So yeah, so that is a great program. But it really, to Megan's point, it needs to be like woven in to every aspect of the organization. And that takes time, and it takes buy-in, and it takes champions. But it's been done, and there's lots of tools out there. And so, there is help for the journey. So thank you, Megan, for, yes, it can be done, and Megan has done it. Okay. Angela, how can we help the broader community and even policymakers balance the benefits of risky play with CSA restrictions, insurance liability concerns, etc.? Yes. So the risk benefit assessment framework that we told you about was created with playground safety inspectors, with insurance, with lawyers, as well as with educators and others. And so we really recognized that that was a big barrier, and we wanted to make sure that those perspectives were in the toolkit so that people could feel more confident about what was in there. And in fact, we have a partnership with a large insurance company in Canada to develop training even for their insurance brokers around this, so that they understand what the issue is. But there are some challenges around, for example, the CSA standards being a requirement for building play spaces. And the approach that we're supporting is really, it's not about getting rid of the CSA standards, but the way that they're applied right now, they very much overstep their scope and their boundary. So they're very much about deciding how kids should play and the play environment, where they should really be limited to, if you have a play structure, how safe is the engineering component of that structure? Is it anchored to the ground correctly? Do you have, enough surfacing underneath? Make sure that there's no head entrapment issues. That is completely legitimate scope for the CSA. But deciding the kinds of activities that should be happening in the play space, or even if you need a play structure, is not the scope for the CSA, and is the scope more for a risk-benefit assessment framework. And so we really are trying hard to change this thinking, to advocate for a change in thinking. It is slow, but it does require lots of diverse voices. So for example, the Council of Chief Medical Officers of Health and their position statement was important in this process. And all of you are important in this process, and to be vocal about it. But just another thing about insurance is that when the insurance companies that I've spoken to really don't, they don't understand why they're seen as the barrier to this. A lot of times that there's assumption that the insurance is going to be an issue, but it requires kind of more conversation and relationship building to dig deeper into that. Rachel, do you think there is a need for more targeted education intervention, example in childcare with parents, community planning, etc., or that we need a broader, all-encompassing approach to increase children's outdoor and risky play? I think it's both. So we've been trying, for example, with the position statement and some of the other advocacy work at that level, to change the cultural discussion and the societal comfort with risk and risky play. And large groups like Active for Life, Parachute, the Saskatchewan Prevention Institute, they've also kind of been part of this conversation to move it along. And that is really important because it's hard to make advances at the local level without changing that cultural conversation. And then, and Rachel, I think, is a bit tongue-in-cheek in this question because she's part of an intervention study that we have funded to look at working with the YMCA in their childcare centers, and actually our intervention addresses the policy of the YMCA, the training that the educators get, the outdoor play space environment, as well as engagement with parents in the community. So you need to think about that kind of ecosystem in changing this. But it is necessary, it is possible, and it requires all of us to be part of it. So Anita, thanks for sharing the Active and Safe link, and Lynn for sharing the Active for Life link, and there's also Active for Life has a whole section on outdoor play. I don't know, Lynn, if you want to share that link as well. And Megan, please check out Megan's website and all the amazing resources that she has, and she's on Instagram and Twitter and all sorts of other places too. Okay, so any other questions? Anybody want to unmute themselves or throw anything in the chat? All right. Well, hearing nothing, and thank you, Megan, for stepping in there. But outdoor play on Active for Life, a few here. Okay. Yeah. So Lynn Job said, I think if you Google outdoor play on Active for Life, you will find other tools there. So thank you, everyone. It's been a pleasure. I appreciate you listening and being so active in your discussions. Oh, do I ever do parent workshops? Yes, I do. Feel free to contact me. It's crazy to see that this is a global problem. Yes, although it looks different in different places in terms of kind of how extensive the problem is and what the problem is. Yeah. Thank you, Drew. Thank you, everyone. And have a good rest of your day. Appreciate it. Take care, everyone.